Moving on, Nigeria's commercial city, Lagos, is currently grappling with one of its worst cholera outbreaks, which is sweeping through some communities in the city. The Nigeria Center for Disease Control and Prevention says over 1,000 suspected cases have been recorded in 31 states between January and June this year. Lagos State alone has now recorded close to 600 suspected cases as the government scrambles to contain the spread of the disease. The state government says the situation is now being better managed and does not pose a serious public health risk. Our correspondent Oge Ukekwe files the report.
The recent cholera outbreak is notably severe and widespread, impacting several states across the country. From January to June 2024, Nigeria has recorded over 1,000 suspected cases. The nation's epicenter, Lagos, has seen a record high number of cholera infections, which has caused significant anxiety among locals. Health authorities in the state say the current strain of the disease is more virulent and spreads fast.
We started to notice cases on the 5th of June. A few cases in our government facilities. It started to rise very gradually to 14 on the 8th and 35 on the 9th. But on the 10th of June, we saw an unprecedented number of cases in our government facilities, predominantly around Lagos Island, Lekki, and Koshofe. This triggered a situation for us, and we activated our Emergency Operations Center.
Ensure that we have stable water supply to our students and pupils, so that they can wash their hands adequately before they enter the classroom and probably after playing during break period. And we also have put in place a team that checks the food vendors in the schools to ensure that we have a very safe food and fruit that is being sold to our students and pupils. We also have a team that check regularly our toilet facilities, and we have not recorded any case of cholera in virtually all our schools, be it public and private in Lagos State.
Health experts blamed poor sanitary conditions and the consumption of contaminated water and food as part of the reasons for the current wave of the outbreak.
Most cases that we had in this area, this area is very close to the lagoon, so the way by which people handle their food materials, the way they get the water they use for drinking, for use at home, the sanitation, it's not really well hygienic.
Lagos, which has the highest fatality of the current outbreak, has caused anxiety among residents, but authorities say there is no cause for alarm and that the situation is under control.
As of the 22nd, the numbers have started to come down, and as yesterday, we had, I think, just 1 or 2 cases reported. We're yet to clean up the data from yesterday, but the general trend is that the numbers have significantly reduced, and we're not seeing the numbers of cases as we did before. We now have the oral cholera vaccine. It is not part of our routine vaccine campaign from the National Primary Healthcare Development Agency. We have a number of vaccines that are routine. We have quite a number of vaccines on that routine list, and we're very careful about adding new vaccines because there's a general global and national sensitivity around vaccines at the moment. So we have to be very sure that the introduction of an oral cholera vaccine will actually make a difference.
Despite assurances, some residents have called on the government to raise more awareness on the disease.
Best thing that they can do now is to be reinforcing, giving the orientation time to time on radio, on television, on how to guide against this cholera, not until we have had an outbreak.
For this, our environment, them creating awareness, we've not seen any awareness of cholera, though they told us in our church that that we should be careful this time around, that it kills so many people. So everybody's taking precaution.
Health experts say the recent outbreak of cholera in Nigeria highlights the critical need for a multimodal response to public health challenges. They say long-term plans centered on infrastructure, healthcare capacity, and preventive measures are crucial to averting future outbreak.
We must learn hand hygiene. In fact, hand hygiene, which involves washing hands with soap and warm water or the use of hand sanitizer, it is one of the main strategies that can help, or the main precaution that can help to prevent or reduce the incidence of cholera.
The NCDC says the country doesn't have enough vaccines at the moment to handle the current outbreak, with the head of agency saying orders for fresh vaccines have been placed with donor agencies and they will be arriving soon.